Assalamu alaikum. Good morning, good afternoon, good evening. My name is Dr. Faisal. I am the chair of the scientific committee, and I'd like to welcome you to the 23rd National Health Science Symposium. Before we begin, I would like to invite Aga Khan for recitation of the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده من ذا الذي يشفع عنده إلا بإذن يعلم ما بين أيديهم وما خلفهم ولا يوهتون بشيء من علمه إلا بما شاء وسع كرسيه السماوات والأرض ولا يؤوده حفظهما وهو العلي العظيم صدق الله العظيم.
Jazakallah. I would like everybody to now rise for the national anthem. I would now like to call upon the Dean Medical College, Dean Adil, to give us an overview and to start the proceedings for the day. Thank you.
Assalamu alaikum and good evening. It is my pleasure to begin by welcoming our keynote speaker and Special Assistant to the Prime Minister on National Health Services Regulations and Coordination, and also a very proud AKU alum's parent, Dr. Faisal Sultan. Also our chief guest, Chief Minister of the Province of Sindh, Mr. Honorable Murad Shah, and our Health Minister from the Province of Sindh, Dr. Azra Pacheco. I'd also like to welcome and so thrilled that our President, Mr. Firoz Rasul, is with us today, along with our Dean of the School of Nursing and Midwifery, Dr. Rozina Karmaliani. I'd also like to acknowledge a few other folks who are watching us, especially the CEO of the hospital, Dr. Shah, and my very special partner, who was the interim CEO through most of the COVID crisis, and now CEO of our outreach and labs, Ms. Shagufta Hassan. You'll notice that Dr. Faisal Mahmood is moderating today. He is the co-chair of the scientific committee and of course, well known to everybody as the Corona Wala doctor. So glad that you're here, along with Dr. Rafat Jan from the Sonam, who is also one of the co-chairs of the conference, and our associate dean for research, who now chairs all of the National Health Sciences research symposiums. And finally, I want to acknowledge, and I'm so thrilled that we have more than 1,000 folks registered, including many of our faculty, staff, and students, people who I like to call our AKU heroes for their incredible resilience and amazing work that they have done throughout the COVID pandemic. I want to begin by giving a little bit of background on what this National Health Sciences Research Symposium is. It is really our flagship scientific event for the year, and now it is in its 23rd offering across the medical college and the School of Nursing and Midwifery. Recently, we decided that from now on, the symposiums are going to be on one of the 6 themes that we have chosen for our academic medical center. This, of course, includes things that you would expect: maternal child health, mind and brain, cancer care, cardiovascular diseases, and other non-communicable diseases. But of course, this year, the obvious choice was to go for the communicable disease leg, and more specifically, focus on COVID-19. Now, we all know about the ravages that we have seen from COVID. From 2 million dead and counting, COVID has now surpassed almost any other thing that we've seen, at least in our lifetimes. From Ebola to MERS to SARS, this pandemic has impacted us in ways that perhaps only a world war would have impacted us. That being said, through this pandemic, we have seen incredible acts of heroism, where we saw healthcare providers on the front lines and making a difference every single day. We saw our communities come together to make a difference, to respond. And we also saw something incredible happen in Pakistan, where we saw great leadership, both at the federal and provincial level, where at the federal level, we saw the NCOC come out with clear mandates, all the way starting from the Prime Minister, all the way down. We're so grateful to have you here, Mr. Faisal Sultan, Dr. Faisal Sultan here today. And at the provincial level as well, we saw the Chief Minister and Health Minister on TV every day giving clear directions, working through how this pandemic worked. We were very fortunate to see how this all worked in Pakistan. And that is probably why we, despite the limited resources of our country, have been commended by so many across the world for our efforts. And we have luckily prevented the kind of mass death and destruction that so many others have had to bear. Still, COVID remains a large problem. Currently, we know we've had more than 5,500,000 cases of COVID. We've had, unfortunately, 12,000 deaths. And we know that these numbers are pretty good because we've had more than 8 million COVID tests conducted across Pakistan. Now, as we heard that COVID is coming, and we saw that it was what it was doing to the rest of the world, we of course became, we began to prepare. And we knew that we had to live up to the expectations we had for ourselves and the rest of the country had for us as a national organization. I'll remember that moment when we heard that the first COVID patient is being admitted to Faisal Mahmood's care at Aga Khan Hospital. And President Rasul will remember that he had us all in one conference room, and that was before we all had to start wearing masks. And he said to us that we will leave no stone unturned, and we will live up to our expectation and do every single thing possible so that we could help the country fight this pandemic. So later on, when folks asked us, are you worried as a private institution being on the front lines? There was never a question. It was always guaranteed that AKU would stand shoulder to shoulder with the rest of the country. We immediately not only provided all sorts of great care and did the first test and all those things that we all know about, but we immediately moved all of our teaching to online, which was a really quick and important feat. We started doing free seminars called the COVID-19, by which more than 6,000 healthcare professionals were taught the initial basics of COVID response. And all of this was done without any cost. And again, today's conference on COVID is again free for all to join. We did more than 10,000 trainings for healthcare providers so that they could remain safe through the We Care initiative. And we are so grateful that the government of Pakistan and the government of Sindh invited us and enabled us to work together to do so many things that have made a difference. I remember when one phone call in which we talked about how we needed to improve critical care capacity from the federal government. And the very next day, Ms. Shagufta and I met with the health minister in Sindh, and they said the same thing. Can you help improve critical care training? And together, we were able to sign MOUs with the federal government, with the Sindh government, and now even with the government of KPK, through which we're doing teleconsultations for severely sick COVID patients. We were able to help with setting up a field isolation center, and our faculty have been on almost every single task force or expert group possible. And we're so grateful that we had the opportunity to do this with the government. This is another remarkable thing that has happened. These kinds of collaborations truly enable us to now go out and say, कि हम इंशाल्लाह मिलके कोरोना को हराएंगे. Now, I just want to finish my introductory remarks by talking a little bit about the conference. This really is our flagship conference, and it's designed so that we can bring together what we have learned. And once we bring together what we have learned, we hope to create the way forward. So, Minister Sahab, we are going to have a closing ceremony, and we're going to have some recommendations based on all of what we've learned from the conference, or what we're going to learn at the conference for the next couple of days. We have more than 20 workshops that are going in parallel. We have more than 1,000 people registered, as I mentioned. There were 300 abstracts. Can you imagine the amount of volume of science we saw? 300 abstracts were submitted, about 200 were accepted. We're going to have 163 poster presentations and about 24 oral original science presentations. It's just incredible the amount of scientific work that has come, even in the midst of a pandemic, when we're meeting virtually, when we are doing all sorts of things. So I hope that we're all going to benefit from this conference, and we're going to come up with a great suite of recommendations that is based on synthesis from this conference. In the end, I want to again thank all the participants who are here. I want to acknowledge our organizing committee. I've mentioned Dr. Asad, Dr. Fajan, Faisal Mahmood, but I also want to mention Dr. Faiza Jahan and Dr. Hani Abdi and all the members of the committees for speakers and the incredible people from communications, resource development, finance, audiovisual, information technology, the conference secretariat, and our administration and research facilitation office. And most of all, our many, many student volunteers who have worked so hard to put together today's conference. Thank you all so much, and we hope you have a wonderful next 2 days. Thank you.
Thank you very much, Dean Adil. I now have the honor of inviting the president of the Aga Khan University, President Firoz Rasul, for the welcome address.
Thank you very much for the introduction, and thank you, Dean Adil Haider, for the opening comments. Dr. Faisal Sultan, the Special Assistant to the Prime Minister for the National Health, Chief Minister, the Honorable Murad Ali Shah, the Minister of Health for the province of Sindh, Dr. Azra Pachuho, as well as other eminent guests who have joined us and will be joining us over the next 3 days to participate in this national conference. This national conference has been an important milestone in our calendar every year because of the opportunity to bring together from across Pakistan the best minds, the best thinking, the best experience, and the best knowledge to be able to understand a problem, a medical problem in an area that affects the entire country. And as the Dean pointed out, this year, it was an obvious choice for us to look at the coronavirus, or particularly COVID-19. This has been an unusual, we've heard words like unprecedented phenomenon that has hit the world. And Pakistan and other countries of the developing world have not been spared. However, for reasons that are still to be understood, although there are some theories as to why, countries like Pakistan have been less impacted than other countries in the West and other countries of similar size in other parts of the world. And this is truly a blessing, but also it speaks to the policies and the actions taken by the governments, both at the federal level, the provincial level, as well as institutions like AKU and other eminent medical institutions in the country through good practices and good policies. This is not an easy thing to implement, and I'm very, it's with great admiration that I say that what Pakistan has done is truly remarkable. However, there's a lot to learn. We have achieved a lot. There's much that we have learned, and there is much yet to learn, as we will see over the next 3 days. And the Aga Khan University is delighted to be able to host this national event, this national forum that enables us to look at and to study and to learn from others, because we have international speakers from around the world, including a keynote speaker from the WHO. And all of this knowledge can only help us coalesce around solutions that can help the country go forward. I'm very grateful to our speakers who have joined us not just today, but over the next 3 days, to enable us to provide a rich set of discussions, a rich opportunity to be able to learn, but also a rich opportunity to be able to contribute to new thinking that will come about. One of the things this pandemic has taught us is that this is a level playing field. Yes, there are richer countries with more resources, but how this disease is affecting different countries is an opportunity for those countries to understand its dimensions within the context within which we live. And so from that point of view, Pakistan has as much to contribute as any other country. And for that, I hope that this forum would enable that to happen. So I want to congratulate all the people and thank them for taking the effort to organize this, and to all the speakers for participating. And I wish all of you, and I'm looking forward to some very exciting presentations for the next few days. Thank you.
Thank you so much, President Rasul. All right, so I guess it's time to start our first keynote address, and I'm honored to have Dr. Faisal Sultan be with us for this. And I'm going to take a few minutes just to talk about Dr. Faisal. Dr. Faisal, most people may not know, was one of the first ID physicians I met when I first came back from America. I met him at one of a conference, and immediately he took me under his wing. And since then, he's been a friend, a mentor, and really an ID physician like none other, really. He's been in the forefront of the COVID response. He was managing everything from Islamabad. Him and I had multiple conversations about this. And now he's obviously the special assistant to the Prime Minister. Dr. Faisal's integrity is something which, even before I was married, my wife had spoken about when she had interacted with him as from a pharmaceutical standpoint. So we're very lucky to have him at the lead at a time when we really need an infectious disease specialist over there. So Dr. Faisal, I'm going to hand off to you. Thank you.
Thank you very much, Faisal Mahmood, for your very kind words. This is like being amongst friends, to be perfectly honest. President Firoz Rasul, Dean Haider, Mr. Murad Shah, Chief Minister of Sindh, Dr. Azra, Health Minister for Sindh. All of you have been partners and colleagues in this effort and endeavor that we have all collectively made to try to battle this challenge that was thrown our way. I'm going to speak a little bit about the challenges that did exist and to some extent still do exist, which were in the way of having an effective and great response to deal with such an epidemic. It's, I think this has been said a million times now, perhaps a billion, about how unprecedented and difficult and different this situation has been. And that is all true. But the first and foremost challenge I think that existed to have a coherent national response was the fact that we are a large country with a devolved federal structure. And we did not, or at least in our lifetimes or in the lifetime of our system, we had had no such challenge that had allowed us to test or even prepare for the kind of challenge that was to come through the COVID-19 pandemic. You will notice around the world that the countries that were like us, with large countries, with devolved federal structures, had the same or similar kinds of challenges. If we look around countries like the United States, our neighbor India, Brazil, again, all large countries with that kind of structure faced similar challenges. I'll talk a little bit later about how I think collectively all of us were able to mitigate some of that difficulty. To begin with, we also were plagued with the very fact that we have generally a weak or weaker health system than a country of our size and capability ought to have. And the other thing beyond the health system was that we were really ill-prepared, I think, as far as pandemic coordination or mechanisms to have pandemic coordinations are concerned. So it's one thing to have good health delivery systems, but yet another to actually respond and react to unprecedented, new and unknown unknowns of this world. So this limited capacity to respond was on top of an inherent weaker health system. The other, of course, thing that goes without saying is that as a poorer country, as a low middle income country, and that is in the throes of development, will, of course, by nature, have to have a tougher choice, almost a Sophie's choice between protecting lives and protecting livelihoods and our life in general. So I think the very fact that our economy is what it is, we are under a double threat or a double pressure of choosing or of going forth with our endeavor against COVID-19, while at the same time continuing business that requires to be continued. This is not a unique challenge, but as I mentioned, it becomes a little bit harder when you are a poorer country. The other challenge, again, not unique to us, but then a little bit heightened for us in some ways, has been that of risk communication and the issue of disinformation. Not that we are, anywhere near unique in this, as I said, but the fact is that when scientific literacy, and literacy in general is lower. And yet we live in the world of social media and WhatsApp and news and information and misinformation that travels at the speed of light. You have this challenge of trying to survive and counter not only the flow of real information, but that whole avalanche of misinformation or disinformation. The other challenge that we have had, and I think we will have and continue to have for a while until we do something about this, is the fact that we have been behind the world for countries of our size and shape in terms of being the ability to produce technology, to produce medicines, to produce vaccines, and even tests. And so therefore, while certainly we wish to be counted, and we would like to be counted as a front runner in many of these areas, the very fact is that these are not areas that have received terribly great attention over our history. And I think this is, again, that a challenge that needs to be met and will be met, inshallah. We also, I mentioned the difficulty of economics, but when you actually have to balance that with health and health risks, and across many domains, from urban to rural, from provinces of a different size and shape, and with somewhat varying challenges, and to keep everybody coherent and on one page has been one of the important challenges. And therefore, moving on from that, the other issue that has plagued us or has been a difficulty for us is the absolute need to tailor our non-pharmaceutical interventions. Were we a more single flavor, single color, single language, smaller country, like many others around the world, it is very different for us to tailor each NPI according to what the need is, and how it can be done, the doability of all these restrictions. And as we went along, we discovered challenges, and interestingly, as President Rasul said, despite our situation, found solutions as well that not only were useful for us, but I think will need to be seen in context by the rest of the world as well once all is said and done. One other challenge that I'd like to mention before I move on to some thoughts about solutions is the issue of enforcement fatigue. Again, this is not unique to us, but when you have a large country and with generally a disposition where we feel that we have a fair amount of autonomy as individuals to be able to do what we want to be asked to restrict ourselves, to wear a mask, or to not go inside a crowded building, or to not have a wedding which is larger than this number or that number, and so on, becomes a challenge for the enforcers to put together and enforce. So what did we do really? I think our cardinals of our response have been, one, early preparations. I think, as Faisal mentioned, back in January last year, we started to connect together under the Ministry of Health. My predecessor, Dr. Zafar Mirza, had put together this working group that met every day online to try to get ready, both in terms of detection, at that time, border security, but also thinking ahead of what was required in terms of diagnostics and treatment, and personal protective equipment, and so forth. This eventually evolved into a more formal, complex structure, which you're all familiar with now, the NCOC. And I really do think that this coordinated, coherent response that came out of the NCOC with the help of everyone in the province, and I truly mean everyone that was involved, from the health ministers to the chief secretaries, to the chief ministers, to their disaster management organizations, to the police, to their civil administration that really came out and helped in areas that they were not exposed to before, I think was something to be seen. So I think this coordination will go down in history as one of the key differentiators. They say that magic is nothing except when something is done in a way that you don't understand, or that there is a lot of preparation to do a little magic trick, and then everybody, once told, it takes away some of the magic. To be perfectly honest, as President Rasul said, there are people do think that there are unknowns, and there certainly always will be. But the fact of it is that the magic actually happened because of this data-driven, coordinated, coherent response. This not only was this coordinated, but I think for once in our history, we were able to respond based on real data and based on honest data. Data is never perfect when we look at large countries, but so long as one recognizes and understands the limitations of it, one is able to stitch together a response. I remember in the early days reaching out to Faisal and to the Honorable Chief Minister offline on phone calls and trying to explain where we were going and listening and having a two-way conversation, which helped build a lot of the trust, which I think has been, again, something unique for our country to be able to do this across all the political domains and divides. The other cardinal of our response, as I alluded to, was the ability to tailor NPIs in our context to minimize damage as much as was possible. There was some, I think there was some disbelief almost of our test trace ability, and understandably. But when we look at things today, the number of people on the average that we are testing and tracing per case of COVID would put many to envy. And I tell you this is across all provinces. Everybody has built their teams, and everybody started from slightly different positions. The tracing teams, etc., were structured differently. But I think eventually we've come to the same place, and we've had a fairly successful run with this strategy. We were able to, again, also use both technology and local knowledge to tailor our lockdowns and restrictions and mandates for movement. And of course, we continue to do disease surveillance, both in sectors that we open, but also in general. The other cardinal, I think, that happened, and everybody must get credit for this, is the ramp up of the healthcare capacity. Whether it was the private sector or the public sector, whether it was the disaster management entities, whether it was the reach out to those that are poor and through the SARS program, etc. The fact of the matter is that we were able to respond to build our capability and capacity and literally respond to it while it was going on. On the health sector, we started out with 100 tests a day, I remember. And the ability today is over 50,000. We really haven't tripped it yet, but over 50,000 tests a day. And given that this is a PCR test, to be able to do it at places, many of whose names some of us had not heard, is something that is creditable to our provincial leadership, but also to the NIH and others that made it happen. Again, we back in June, when the epidemic really started to crest, we needed to build oxygenated beds and vent capacity in a hurry. And this was done. And fortunately, barring a few days here and there where there were individual pockets of trip-ups, but the overall system still kept its head and nose above the water, fundamentally because everybody had built this capability. We had days, I remember, when an N95 mask was perhaps more valuable than anything that we could think of. This was a prized entity, and I told my military colleagues at the NCOC that this ought to be issued like a weapon that they issue to a soldier, and it's returned back with the serial number and the bullets counted. And so I think we learned how to procure, produce, and manage these PPEs. And eventually, of course, global production also picked up. So things became better that way. But to supply all our frontline workers and in real time was something that had to be done. We've seen the sparking of our biomedical industry, ventilators. I think you will see that Pakistan will become an important player in the production of biomedical machines, simply because of getting jolted out of this slumber that we can't do it, or we shouldn't be do it, or that we cannot do it. I think this can do will happen from here on. You mentioned training of health workers. Absolutely. It wouldn't have been possible without help from places like the AKU and cooperation between the university, the center, and the National Health Ministry, and to produce quick critical care specialists. I mentioned risk communication early, but I think it really, we were, I think, also able to, as a country, respond to this. Having a set of guidelines, I think Dean Haider mentioned the fact that your institution really served on virtually every important expert committee, whether on diagnostics or infection control or treatment or literally anything. And I think we were able to bring together all these experts, which helped in the risk communication. If you have credible experts who come out and say stuff that needs to be done, it carries perhaps even more weight than an international entity saying this. And I think we saw this to the extent that this little, well, not little anymore, this very, very important WhatsApp group that one of our ex-trainees, Dr. Naseem, made, which now has grown into, I think, the most agile and responsive entity as far as infectious disease expertise and advice is concerned. At any given hour of the day and night, you can get a response on really pithy, hard, tough nut problems. So this expertise really lent credibility to the risk communication, and coherent and credible guidelines made life a little bit easier, and we were able to engage our fearful health workforce. A little bit, before I close, a little bit about vaccine. Now, we started out selecting vaccines for safety, efficacy, availability, and the logistic ease of it. And we are fortunately at this time in a situation where we have 3 vaccines that are licensed for use, and more, I predict that there will be more that will be granted an emergency use authorization. This ability for our drug regulatory authority, which still requires a lot of help in terms of coming up to speed for into the modern world, but yet I think it rose to the occasion and was able to create and redo some of its approval systems to respond to this really unusual situation. We were able to, again, have vaccine management systems in place to deploy the vaccine at large scale, and the use of a central dashboard to help follow, track, and trace all those that we have vaccinated. We've, of course, defined vaccine groups. I'll just briefly mention frontline healthcare workers who are currently getting the vaccine across all provinces. And we're seeing good numbers, and it's actually picking up how this is going. I do feel that this phase will be completed in 2 to 3 weeks. And then hopefully we can get on to our next phase where we can start to protect our citizens, non-healthcare workers over the age of 60 as well, and then to gradually work down the age bracket. We are in multilateral engagements as well as bilaterals with the manufacturers and governments. And I do think that this month, February, I think was the month of supply being the focus of our attention. But I think very soon we will need to focus on the demand side of it. I've had conversations with Dr. Azra and other colleagues where we feel that there has been vaccine hesitancy, even amongst healthcare workers. And therefore that engagement really will be needed. And in fact, much more when it actually comes to the public at large. And that is where our biggest challenge would be, because if we really need to reach societal protection levels, we would need to make sure that there is acceptance of this vaccination program. And again, credibility, transparency, good communication will help us in going forth. At the very end, I'd like to talk a little bit about the way forward. I think I've mentioned some of these factors, but the fact is we need to really be able to develop and deploy pharmaceutical interventions and develop our own vaccines. People talk of security challenges, but I think finally we've all figured this out, that even vaccine dependence on everyone else around the world for production, for innovation, is a threat that we as a country just cannot afford to have. So we need to spark our pharma and vaccine and biologic industries, and you will see some of the actions coming out, inshallah, soon enough. We do need to have a better health system, both in terms of capability, but also in terms of disease surveillance. One of the important reform ventures that was on the cards, in any case, before COVID, was the reform of the National Institute of Health to actually include in a CDC Pakistan, something that I have been talking about in my sort of personal and infectious diseases role with my colleagues at the ID Society. But it has finally happened. We have an ordinance in place, and we intend to bring a full act to have the full force of law to help us have a CDC Pakistan, a health data center, a strengthened, augmented national health laboratory to help with diagnostics and orphan tests and so on, but also to spark innovation across the fields of vaccinology and so on. So I think that this would be a pivotal institution. We are trying our best to bring in on the governing entity people who are of the highest caliber and standing. And again, perhaps you will see your institution figuring there as well. I will end by saying that at this time, one of the important things that we do have, which is never a science, more of an art, but always a science in the end, is risk communication and community engagement. I think that if we are not able to engage our communities effectively on this matter, then bringing us back to normal, as everybody keeps talking about, will take longer. And therefore, it is crucial for us. We are a country that sends so much of labor overseas. We are travelers. We travel the world because of business and increasingly for pleasure as well. But also in a connected world, it'll be crucially important for us to have a solidly vaccinated population. And it'll require the help and cooperation of everybody around. I'll stop here. I'd like to thank everybody for their patience as well as for inviting me here. This has been a roller coaster of a journey, but you know, what a storm to be in the middle of it. Thank you very much.
Thank you so much, Dr. Faisal. That was a wonderful overview and really a nice sort of a summary of what we've done. And you know, one of the most common questions we get asked is, you know, what happened? Why did Pakistan not get hit as bad as we did? And this is a testament really of all of the hard work that was put in doing it. It didn't really happen by itself. So before we go to the next keynote speaker, I just want to do two things. One is I just want to reiterate what Dr. Faisal mentioned about the vaccine. I will tell you I got my vaccine just 2 hours ago. I'm still standing here. All frontline healthcare workers, please get your vaccine. Don't worry, it's safe and it's needed. And this is really, in my mind, it is your national duty to get the vaccine and social duty to get the vaccine and show people that these vaccines are safe, especially because when the general public comes, it's going to be a lot of vaccine hesitancy. But I'm going to get off my soapbox, and I just want to go over the symposium and a little bit about what you'll see in the next 2 days. Once you register, this is going to be your portal and your gateway into knowing what's going on. And you can see my screen. Yes. So this is where all the agendas are, and there are going to be 2 days. So that's Friday and Saturday. And what we have planned for you are 3 parallel sessions. So, and each parallel session is dealing with a different track. So, for example, on the first day, track 1 is management, then the track 2 is public health, and track 3 is basic sciences and diagnostics. So you can pick your track, and then once you click on it, you can join the session and take it from there. And we've done this so that, you know, there's some overlap, but not a lot of overlap, and people with their own special interests can then join whatever they would like to. The next day, again, we have 3 tracks, and they include vaccines and public health. We have management, impact, and a wonderful sort of ethics session, which will be live, and perspectives and talks about research and really the challenges that we see in research in COVID-19. With this platform, you can also look at our speakers, and you can even click on speakers, for example, Dr. Bushra, and what talk she will be doing, which is in case you want to focus on a given speaker and this session. And finally, the posters, as Dean Adil mentioned, we had a number of entries. Some of these will be as free papers, but all the posters are over here. You can click on any of the posters. For example, I'll just click a random one right over here. You can see a little overview of the poster. You can download the poster to view later on if you like. And you can also email the person directly if you have any further questions. And this is a great way to network and to connect, because as you know, with COVID and the conferences, we don't really get time to sit and chat anymore as we used to. So I would encourage everybody before the conference to go online onto the portal and just explore and play around with it. And if you have any issues, any problems, any feedback, do let us know. Just email us, and we will get right back to you and sort it out. Now I'm going to introduce the next speaker. I'm going to go to my place over there. All right. So for the next speaker, I am very proud to introduce Dr. Maria Van Korkov. She is the technical lead for the COVID response. She has been the head of the outbreak investigation task force at Louis Pasteur, where she's done field research on Zika, on MERS-CoV-2, on Ebola, and Marburg. And she really has been the WHO face for COVID-19. She is going to give us a talk on the COVID-19 situation and the strategic response. Dr. Maria.
Hi, my name is Maria Van Korkov. I'm an infectious disease epidemiologist with the World Health Organization and the COVID technical lead. Over the next few minutes, I'm going to give you an overview of the current situation of the global pandemic and WHO's involvement in coordinating the global response. Thanks for the opportunity to speak with you today. On the first slide, what you see here is the global epidemic curve of SARS-CoV-2, the virus that causes COVID-19. In the different colors is the epidemic curve by region, and you can see some key dates in which WHO activated its response, starting from January 1st, where we activated our incident management team one day after we first became aware of the cluster of pneumonia of unknown etiology from Wuhan, China. Over the next series of days, we issued some alerts through our EIS platform and our disease outbreak news, as well as issuing a full package of technical guidance on the 10th, 11th, and 12th of January. This included guidance on how to find cases, test cases, care for cases, protect healthcare workers, and we issued a series of questions and packaging checklists so that countries could get ready to prepare for any potential cases that would show up in their countries. On the 30th of January, the Director General declared a public health emergency of international concern. At that time, there were less than 100 cases outside of China and no deaths reported outside of China. Within 4 days of that declaration of a public health emergency of international concern, WHO issued our first strategic preparedness and response plan outlining how to get ready and prepare and find cases to control onward spread. You can see the resulting epidemic curve over the last year. And to date, as of yesterday, there were more than 105 million cases reported to WHO, including more than 2.3 million deaths. If we do look at the epidemic trends by region, there's quite some heterogeneity by region. This is broken down by WHO regions, the 6 WHO regions, as you can see here. And there are different patterns that we see by region. If you look at the countries within each region, there is even more heterogeneity. And we see countries that have experienced different levels of intensity. Some countries have avoided large outbreaks overall, and you can see that illustrated in the upper left-hand corner. Some countries have had major outbreaks and they've brought those largely under controls, illustrated by the epi curve on the upper right-hand corner. We have had several countries that have had major outbreaks. They've had peak after peak, where they've been able to bring transmission under control and have seen resurgence as societies have opened up. And we have some countries that have just seen intense and ongoing transmission since the beginning of that pandemic. One of the important challenges to highlight in this pandemic, a year in and after more than 100 million cases, is that we are now starting to see virus variants being detected in a number of countries. So far, we've seen 4 virus variants that are of concern that we are tracking. The first in Denmark, one in the United Kingdom, one in South Africa, and one in Brazil. Now, various viruses change all the time through mutations, and we expect that there will be changes in viruses. Most of these changes are neutral, although some may make the virus more fit. WHO is working with countries to make sure that we have increased diagnostic and sequencing capacities global so that we can detect these mutations and we can follow and track these changes over time. WHO has a virus evolution working group that was formally established in June to make sure that we understood which mutations were being detected and to study the coordinate the studies that are required to evaluate each of these mutations and variants in terms of transmission, disease presentation and severity, but also on potential impacts of diagnostics, vaccines, and therapeutics. This requires a lot of coordination across many different research partners within WHO at the 3 levels of our organization, as well as with many different partners who are carrying out research around the world. What is very critical is that we establish a very robust monitoring framework so that studies can be done and we can evaluate in real time any potential impact on our countermeasures. If we look at the WHO global strategy for COVID-19, we issued our first strategic preparedness and response plan on the 4th of February, 2020, and this has been updated several times since then, but our goals remain the same. Our goals are to suppress transmission, protect the vulnerable, and to save lives. In that first strategic plan, we outlined our global objectives, which are and remain the following: to mobilize all sectors and communities to ensure that every sector of government and society takes ownership and participates in the response and in preventing cases through hand hygiene, respiratory etiquette, and individual level physical distancing, to control sporadic cases and clusters and prevent community transmission by rapidly finding and isolating all cases, providing them with the appropriate care, and tracing, quarantining, and supporting all contacts. This is what breaks chains of transmission. To suppress community transmission through context-appropriate IPC, infection prevention and control measures, population-level physical distancing, and appropriate and proportionate restrictions on non-essential domestic and international travel. To reduce mortality by providing clinical care for those who are affected by COVID-19, ensuring the continuity of essential health and social services, and protecting frontline workers and vulnerable populations. And finally, to develop safe and effective vaccines, not just one safe and effective vaccine, but multiple safe and effective vaccines, and to ensure that these can be delivered and produced at scale to make sure that they are available to all of those who are in need. The pillars of the SPRP response are outlined here. We have added an additional pillar for vaccination now that we have several safe and effective vaccines that are starting to come online. As I said, the plan in the beginning was to make sure that we had a comprehensive all of society and all of government approach. And now we are adding vaccines and vaccination as an important additional tool in our integrated response for COVID-19. But one of the things that underlines everything that we do is science, and science drives our understanding. It has been an incredible year of collaboration, coordination, and solidarity across the many different scientific fields, where we are learning something new about this virus and the way the virus behaves, the disease that it causes every single day. Some of the areas in which we spend a lot of our time in terms of understanding the science is related to severity, in terms of natural history and disease progression, risk factors for severe disease and death, looking at recovery and the long-term effects. This is an area where we are starting to begin to understand the long-term effects from people who are infected with SARS-CoV-2, really is trying to disentangle the differences in mortality that we are seeing by age, by region, by response, and looking at the infection fatality ratio. Again, there's a big difference in infection fatality ratio by age. And on the bottom left there, you can see one example of some estimates of severity looking at the infection fatality ratio, or the IFR. Another area that's we spend a lot of time on is understanding transmission. Transmission, there are a lot of different factors that we need to consider, and the importance of the intensity, duration, and context of the exposure that each of us has or tries to reduce to this virus. Looking at the relative contributions of the different modes of transmission, there are many different modes of transmission, but what we understand is that most people are infected by close contact with infected individuals. We know individuals can spread when they do have symptoms as well as when they don't have symptoms. In fact, WHO updated our guidance in late January and early February to take into the account the potential for asymptomatic transmission following a cluster of cases that were identified in Bavaria, Germany. And with updated information on viral shedding, we know that people appear to be most infectious about 2 days before symptom onset, at the time of symptom onset, and through the first 5 to 7 days among mild patients, and that could be up to 3 weeks for severe patients. We know there are many different settings in which transmission can be amplified. Again, if people are spending more time indoors, if there are crowded spaces, spend prolonged periods of time together, and especially in areas where there is poor ventilation, transmission will be amplified. There's a lot of very good work that's happening looking at secondary attack rates and cluster investigations. These provide very important clues about how the virus spreads and what we can do to prevent it. Much of transmission is happening in the home. It started that way in the beginning and it still remains one of the riskiest places, but there are many things that we could do at home to ensure that we keep ourselves and our loved ones safe. We are following and tracking the extent of infection as measured by seroepidemiology, and there are more than 300 studies that have been published to date, with hundreds more that are currently being carried out in high and low and middle income countries to really understand how many people across the world have had evidence of infection, how long the antibody response lasts, and what that really means for immunity. And we're really still trying to disentangle our understanding of transmission in children. There are differences by age group, with the youngest children seemingly having lower rates of seroprevalence, lower rates of transmission between each other, but that likely has to do with contact patterns. And we do see adolescents that can be infected and transmit almost at the same rates as adults. But again, that's driven by contact patterns. But science is always driving our understanding, and we are constantly reviewing data. We are constantly updating our guidance and turning that technical knowledge into coordinated action. There are more than 500 pieces of guidance that have been published to date. We work with thousands of scientists around the world, including many of you who have contributed to the global discussion of our understanding and turning that technical knowledge into practical guidance related to clinical management, related to infection prevention and control, and related to contact tracing, et cetera. So we thank you very much for your support in that. In this graphic here, this is a loop of information and implementation, starting from leveraging evidence and expertise through our networks, through our collaborating centers, through our strategic advisory groups, turning that into rapidly and constantly evaluated guidance, which is multidisciplinary, multilingual, multi-agency, and adapted into different contexts. We do our best to share that through different channels, whether this is through written guidance materials or open WHO platforms, our MOOCs that many of you have signed up for, through our critical regional offices and country offices, making sure that these are tailored and targeted for the populations in need, and making sure that we work through our many different UN platforms. But that's not enough. We need to constantly monitor and learn from the use of this guidance so that we could feed that back into updates. And we are working really hard to ensure that what we provide is not only evidence-based, but it's practical and it's realistic for on-the-ground use. But this is a constant loop, and we are consistently learning from all of you, and we thank you for your feedback. There are many achievements through this COVID-19 response. The pandemic is far from over, but one of the biggest challenges we have had is through the supply chain. We've worked with many different partners across the UN and beyond to ship critical items of personal protective equipment, including masks, gloves, goggles, gowns, diagnostic equipment, different types of diagnostic equipment based on the platforms that are in use in countries. And we will continue to do so. While the global supply chain has improved over time, we still are lacking the ability to provide PPE to everyone in need, especially health workers and frontline workers. We're working to mainly make sure that they have the adequate level of protection to care for COVID-19 patients all over the world. Now, if we look ahead, what is really important, especially as we see some of these virus variants being detected, is that we stay the course. We know so much more now than we did a year ago. We have developed guidance, and scientifically robust guidance solutions, but we haven't yet applied this all over the world, consistently, comprehensively, or evenly. And in 2021, we really must redouble our efforts to suppress transmission, to protect the vulnerable and save lives in a comprehensive and a coordinated way. The epidemiologic situation remains dynamic and uneven, and this is further complicated by the virus variants of concern. But what we have seen in a number of countries, especially where these virus variants are circulating, is that public health and social measures continue to drive down transmission. Public health and social measures still can control COVID, including these virus variants. What is really critical as vaccines come online is that we continue not only to make sure that the vaccines are rolled out and received by those who are most vulnerable, these are people who are of older age and of our frontline workers, but that we still continue to adhere to the individual level measures, including hand hygiene, physical distancing, mask wearing, avoided crowded spaces, improving ventilation by opening windows, making sure that we do everything that we can to prevent ourselves from getting infected. And if we are infected, make sure that we are isolated, we get good clinical care, and that we prevent onward spread. So there's a lot that we can still do. We still need to fight against the infodemic. There's a huge amount of information, misinformation and disinformation that continues to circulate, and this is challenging all aspects of our response. We know that empowered communities play a critical role in the control of COVID-19, but misinformation and disinformation continue to undermine all of the evidence-based response and individual level behavior that we have. Science itself and scientists and public health professionals, including you, have delivered on solutions, and these are being delivered at scale. But we need strong mechanisms to make sure that there's equitable delivery of these interventions, including vaccines and vaccinations. The COVAX facility is working very hard to ensure that we have fair allocation to the safe and effective vaccines. We need to make sure that these are delivered around the world. And we need to continue to make sure that we have strong, robust healthcare systems and workers, including those who are trained, protected through their work in the workplace as well as at home. And we need to keep up our surveillance, not only epidemiologic surveillance, but diagnostic, molecular testing. We need to increase the use of rapid antigen-based RDTs, as well as improving genomic sequencing around the world so that we can track virus evolution around the world. This slide here gives an overview of our current focus, looking at reducing mortality and saving lives. We have so much more now. We have more experience with COVID-19. Our health workers are doing an incredible job of caring for patients, making sure that they enter the clinical care pathway quickly and they receive the care that they need. They have dexamethasone for those who are severe and critical. This saves lives. We are working very hard to make sure that O2, oxygen, and therapeutics are available in all countries. And this is not only important for COVID-19, but it is important for diseases in all countries. We want to work very hard and continue to work hard to suppress transmission, prevent as many infections as we can. This reduces pressure on the virus to change, but also it, of course, reduces the burden on healthcare systems. The fewer cases we have, the fewer that will need hospitalization, the fewer that will end up in ICU, and the fewer that will die. And we cannot do any of this without empowering individuals and communities for action. We have to ensure that we provide individuals with the right information to know what their risk is so that they can reduce their risk, keep themselves and their loved ones safe. As we think forward, We have a comprehensive and integrated plan moving forward, making sure that we add vaccines and vaccinations into the current strategy. But there's a lot of work to continue to prepare, empower, respond, accelerate, strengthen, adapt, and integrate all of these measures as we go forward. And it needs to be put into the broader humanitarian context and recovery programs. We have a long way to go, but we have achieved much this year. We need to stay the course, stay focused, work incredibly hard to prevent as many infections as we can, save as many lives as we can going forward. It's a challenging environment that we all work in, but we stay rooted in the science and the evidence, and we do everything that we can. We are doing everything that we can, and we thank you for your help in issuing important evidence-based practical guidance to support in the response. Thanks very much for the opportunity to speak with you today.
Thank you so much, Dr. Maria. That was a wonderful talk and a great introduction of an overview of what the WHO has been doing. So before we move on to our chief guest, I just want to introduce Dr. Asad Ali. Dr. Asad Ali is the chair of the conference, and those who don't know him, Dr. Asad is probably our youngest professor. He's also the Associate Dean of Research here at AKU, and really an extremely dynamic person. Again, those who may not know this, but he's also a great social entrepreneur from his Sadka Pakistan and his work with Moringa and really bringing local solutions to local problems, which is something that people often forget. So Dr. Asad, on to you.
Thank you very much, Dr. Faisal. And I just wanted to come in and take this opportunity to really thank everybody for joining. It's just, this was a lot of work to put this conference together, but I'm just so thrilled that we have more than 1,000 people right now watching us in different fora. And this is just fantastic for the inaugural session. And I also want to particularly encourage people to join us in the over the next 2 days as well, when we have a very rich program. This time, because of COVID, we went virtual. So in order to ensure maximum participation, everything is free. So the registration to this conference is free. The registration to the workshops that the Dean mentioned earlier is free. So I would particularly encourage everybody to please go and check the program out. We have 3 parallel, so the days start with at 8 o'clock tomorrow with 3 sessions of Meet the Professors. You will have an opportunity to speak with one of the 3 professors that we have. We have a public health expert in there. We have a clinical expert, Dr. Faisal Mahmood, and then from the labs and basic sciences, we have Dr. Zara Hassan over there. So you can just join at that time at 8 o'clock. These professors will be there, and you can join and have a one-on-one discussion with them, ask them questions and engage in discussion. And then after that, there are 3 parallel tracks, and you can join at any time, and hopefully this will be very useful to you. So the sessions that we have are such that they cover everybody's interest. So if you are a clinician looking for cutting edge knowledge about how to manage your COVID patients, this you'll hear from the leading experts in the field on this. If you are a public health expert, you will hear from some of the leading experts. Dr. Zafar Mirza is going to be here, and a lot of leading experts who will be talking about that element. If you are into economics, and if you want to have a look at or if you want to learn about how COVID has impacted economically and what segment of the population has been most affected, that we have some very eminent speakers. We have the head of McKinsey Pakistan come and speak with us in here. Our CHS chair will be speaking in there, and that will be a forum where even if you are not hardcore medical, you will find these to be very, very useful. If you are into education, then we have some eminent education scholars who will be coming in and really engaging in the debate over schools. Should they be open? Should they not be open? And what are the other, how have different institutions dealt with this challenge of COVID in terms of education. So there is a separate track for that, and you will find that also very useful. If you are a basic scientist, then we have world experts from all over the globe coming in and speaking on different elements of COVID biology, on COVID diagnostics, on other cutting edge bench-side research related to COVID. So all of those are available. If you so if you are into in the end, in the concluding session tomorrow, what you will have is a day after tomorrow, what you will have is a summary where basically the gist of all this discussion is going to be there. So I would strongly encourage you all, just like today, we have more than 1,000 people online right now. It would make us all our efforts come to fruition if tomorrow also we see you over there, and please feel free to share this with all your colleagues that they really should take advantage of this opportunity. I now hand over to Dr. Faisal for introducing the chief guest and the other and the rest of the program. Thank you.
Thank you so much, Professor Asad Ali. Now it's my great honor and privilege to introduce our chief guest, the Honorable Chief Minister Murad Shah. I met him actually for the first time during one of the COVID meetings, and I'm honored to be part of the task force that he had developed. And his meetings, or these meetings, started really when the first case started, and we would meet almost every day. And I still am extremely impressed with how astute he was with looking at the data, listening to people's input, and then coming up with decisions which were not only both difficult, but also practical, and keeping in mind and keeping in view what the real ground realities were. And really, I think in many ways, we've gotten this far thanks to the leadership that he provided during these really difficult So I'd like to now introduce the Honorable Chief Minister, Murad Shah.
Thank you, Dr. Faisal. I hope all of you can hear me. I believe
yes.
You can. Okay, great. Thank you very much, Dr. Faisal, for your kind introduction. And I thank the Aga Khan University and the organizers of the 23rd National Health Sciences Research Symposium for inviting me here today and allow me to speak to you. I'm probably the least qualified person to talk about COVID. Exactly a year ago, the only thing I knew about Corona was that it's a car that the Japanese used to make, which they have discontinued. And that's where I started from. I'm grateful to all the experts who came and educated me. The story of Corona for the province of Sindh, 26th of February last year, 2020, we had this first case late in the evening, around 6 or 7 p.m. I thought about this first case, which was detected at the Aga Khan University. In fact, this was probably the second case, because a case was also detected in Islamabad, and both of them were announced simultaneously on the 26th. Didn't know anything about Corona. What we did was, on the very next day, that night, I spoke with the chief and I asked him to set up a office phone number in his office and sit people there and just take calls and see what needs to be done. The very next day, we sat in this room that I'm sitting right now, and that's, as Dr. Faisal told you, that's when I met Dr. Faisal Mahmood and so many other brilliant people who guided us to combat this pandemic in the initial days. This room that I'm sitting in, and I claim this was the war room for COVID's fight against Pakistan's fight against COVID. the very first day, the 27th of February, the first day after the first case hit us, we met here. In fact, even before we met here, on the 26th of February, I believe it was a Wednesday, and what I did late night was close down all the schools in the province of Sindh for 2 days. Initially, we didn't know what was going to happen, so Thursday and Friday, the schools were closed down. The very next day when we met and we discussed, we closed them down till the 15th of March last year. And then they were closed for the next 6 or 7 months. I don't remember the exact date. A number of steps that we took along with, with the experts, we started closing down markets. We started closing down intercity transport. And we worked towards, because we were working towards a lockdown strategy. What the rest of the world has done, we were just learning from that. We, on this first day, on the 27th, set up a task force, as Dr. Faisal told you. This task force for the first, I believe, 2 months, met on a daily basis. Except for a few days, we actually met on those days also. For a few days, I was exposed to a COVID positive patient. And during that time, I used to attend the meeting from another room in the Chief Minister's house while the rest of the team was sitting here in this room. And we worked on the steps that had to be taken to combat the pandemic. First challenge that we faced, obviously the challenges were tremendous, but the first challenge that we faced was the pilgrims who were coming from Iran. The first case in Karachi was from a pilgrim who'd come from Iran by air. And second to that, the pilgrims who'd gone by road were to return. They were initially held at the border for a couple of weeks or a little less than 2 weeks. But then we were told on the 10th or 11th of March, I believe, that they'd be coming to, they would be sent to the provinces of their residence. We in this room decided that we'd keep all the pilgrims in one place at Sakkar. And at that time, we created, I believe, until date, was the largest single center of the single isolation center or a quarantine center for COVID. This was the labor colony in Sakkar. This labor and colony in Sakkar, I've forgotten the numbers, but more than 1,200 pilgrims were housed there. Almost 1/4 of them during the first test came out as positive, but we had to retain all of them there because they were intermingling and they were meeting, so we could not leave them. We set up a protocol that we'll not leave them till they get 2 consecutive negative COVID tests. During those days, the only place where we could get a COVID test done was the Aga Khan University. And Indus Hospital also started soon. We had our OJA facility in Karachi, the Dhar University of Health Sciences. And starting from 100 tests per day, we now have the capacity of almost 1,200 tests a day if we need to use them. And on an average, we are doing 12,000 tests a day. Our province had the strategy of identifying the possible COVID patients. We set up a desk at the airport. All the passengers coming in from abroad were screened at the airport. Then we had a system where they were followed up for at least 2 weeks, almost on a daily basis, to make sure that they don't have any symptoms. The ones who had symptoms, we made sure that we got them tested immediately. As I said, we started closing down intercity transport. And by the 23rd of March, I believe it was the 22nd of March, where we officially announced a complete lockdown in the province of Sindh. And we got all the political parties to agree to this lockdown. We spoke with the religious scholars and convince them that they should also agree to it, closing down, or we didn't close down any mosques, but limiting the attendance at mosques was a major issue. But by the grace of Almighty Allah, we were able to convince the religious scholars that this is the need of the day. We did initially, and to this date, had a lot of resistance to the approach that we were taking. We thought this was the best approach. The question was between lives and livelihood. And the province of Sindh, the government of Sindh, thought it was a no-brainer and lives should have precedence. And that's why we did suffer. Yes, the country did suffer. And that's the entire world. The entire world has suffered due to COVID, and we obviously suffered along with the entire world. The initial steps, I believe, that we took in the province of Sindh created this atmosphere. The other provinces followed us. The province of Punjab, Khyber Pakhtunkhwa, Balochistan, Azad Jammu and Kashmir, Gilgit-Baltistan, all followed suit. At the national level, the Prime Minister set up the coordination, the NCC, National Coordination Committee for COVID. Then there was a body under it which met on a daily basis, the NCOC, and the province of Sindh participated in the NCOC, and to date, those meetings are taking place. A unified approach was taken in the country, and I believe that our initial steps paved the way for decision making by the entire country, and by the grace of Almighty Allah, our country fared much better than most of the countries in the world. I believe we could have done better, especially during the second wave. I thought we should have closed down or started a lockdown for at least 2 weeks, if not 4, to slow down the spread of COVID. In the second round that we had, I feel at least I know of many more people who've suffered from this disease and many more people who have lost their lives during the second wave. I don't know, the numbers maybe don't show this, but in the first round, we did not know of too many people, or I did not know too many people who died because of COVID, but in the second round, we're hearing of a death in almost every family that I know in this country has suffered because of COVID. In terms of improving our health facilities, we started from the very first day when we were sitting in this room and we talked about our preparedness. And we were not at all satisfied with where we were. But then the health department worked day and night. We had the Indus Hospital, the Aga Khan University Hospital support us tremendously. We had a lot of support from the private sector. We created a COVID fund, which was administered by 5 people, 2 from the government, the Chief Secretary and the Finance Secretary, and 3 people from the private sector. Renowned names like Dr. Bari, Faisal, and Chapra Sahab, Mushtaq Chapra Sahab, and people contributed to this fund. And I always tell you the story that whenever I talk about this, I was sitting in my office and my assistant came in with a check of ₹1 million from an unknown person, along with a letter. So this letter had this number with a phone number, and I called this person to thank him, and he was very upset as to why I had called him. And he said, no, your government is doing a lot. And he was a retired person, 88-year-old, who had given ₹1 million to this fund. And I always tell you about the story. And apart from others, we got donations from overseas. We got more than ₹4 billion in this COVID fund that we had. We have spent a lot of money. We diverted all our resources towards health. We've had the largest, at that time, the largest isolation center in at the Expo Center in Karachi. Since then, we've built a hospital that was under construction. We converted that into an infectious disease hospital, and it's I believe, the only full-time infectious disease hospital in the country. And we want to make that into an institute, and we have the space that, inshallah, we're going to do it. So a lot of efforts were taken by the government of Sindh. They have paid dividends, and I said, I believe we led the way for the entire country. And the initial steps that were taken in this very room, and I'm grateful to the people who helped us. And I've mentioned a number of times, Dr. Faisal Mahmood is here in this conference with us, Dr. Bari, the WHO, UNICEF. We had the federal immigration authorities come into this room because we were tracking each and every passenger who had entered the country since 15th of February. We had a cutoff date. We started with the 15th of February, and we traced each and every passenger who'd arrived at Karachi airport, and we were following them up in the entire province to make sure that they don't have any symptoms, and if they had symptoms, to have them tested. And that's how we got our first patients. And this was this effort that was taken that prevented the widespread spread of this disease, especially in the rural areas. If you go to the rural areas, people still do not believe that this pandemic is there because they were not affected. And the only reason this is the case is because the intercity transport was shut down from the very first few days. So 2020, if anybody would remember it, it'd be for COVID. I hope 2021 marks the end of COVID from this planet. And 2021, the various efforts that the medical sciences is doing in terms of the vaccines, it comes to fruition, and we are able to vaccinate the required number of people to get the herd immunity that we've been wanting to have. One last thing before I end. I went to see somebody who had lost a dear one from COVID, and he said one thing which stuck in my head. Though I myself encountered COVID, I was also infected. I was out for about 20 days, isolated. Grace of Almighty Allah, I did not have many symptoms except for temperature. But this person that I met had lost a dear one, and he said a very simple thing. What he told me was that the minutest of ailments, the basic, you can get ill, you get a headache, or God forbid, you get some cardiac issues, or you get cancer, the most expensive treatments in the world right now. You cannot avoid them. A headache you get for various reasons, there's nothing you can do. Almost all of us must have had headache at some point in time or the other. You get cancer again. We do not even know what is causing cancer, and you spend a lot of money on its cure. But COVID, you can manage. The only thing you need to do is take care. If you are careful, if you wear a mask, if you follow the SOPs, if you follow social distancing that all of us have been talking about, you will not get infected. And there are a lot of people who've not got infected, but they do take care by washing hands, by using hand sanitizers, by wearing a mask, not going in public unless required. So this ailment is in your hands. Unfortunately, there is a cure for headache. You can take a tablet and get well. There are cures for cancer also. There's no known cure for COVID once, as far as I know, once you've had it. You just hope that your body is strong enough to counter the virus and create antibodies and fight the virus. At this moment, you can't just take a pill or an injection and get rid of COVID immediately. You can only strengthen your own immune system during the time that you have COVID. So it's up to us to take proper precautions so that we won't get this virus. As for the other disease, sometimes they're not in your hand, but this disease is in our hand. And we need to take proper precautions to make sure that we are not hit by this disease. Once again, I thank the organizers. Dr. Adil Haider was kind enough to invite me, and Professor Asad Ali, the chair of the organizing committee. I see Mr. Firoz, Rasul there, president of Aga Khan University, Dr. Faisal Sultan, special assistant to the Prime Minister is there. I thank all of them for having me here today and allowing me this privilege to speak to this August gathering. Thank you very much.
Thank you so much, sir, for this wonderful sort of overview and brought back memories from that time. It seems like a long time ago. I would like to invite President Rasul to formally thank our chief guest.
Dear Chief Minister, let me begin by expressing our deep gratitude to you for gracing this occasion. It's a very important conference, and your presence here has given us much encouragement, support, and wisdom that you have acquired through some painful experiences, as you have just explained, and what you have described at the ground level, realities that you had to deal with, which were not necessarily medical in nature, but had to deal with people, logistics, politics, social issues, movements of people, migrants, people returning from pilgrimage, and the day-to-day realities that the governments have to deal with. So I want to express our gratitude for the partnership, for giving us the opportunity to learn with you, and also for your constant encouragement, your constant support to us in helping us become much better, and that we can continue to learn together. So it's my duty to say that you have enhanced this particular conference, but also our overall experience and learning. And I'm sure the participants will have learned a great deal about what it is like to be a leader of a government that has to deal with these particular realities. As Dr. Sultan has also explained to us, the challenges that the federal government face. So thank you for your leadership, and thank you for your encouragement and support. Thank you, Chief Minister.
Thank you so much, President Rasul. In the end, I would like to call upon Professor Rozina Karmali, who is the Dean of the School of Nursing, for the vote of thanks.
Thank you, Dr. Faisal. This is my honor and pleasant duty to say this 23rd symposium close. But before I close it, this was our honor to have prominent speakers. I would like to thank our chief guest, Chief Minister. Also, I would like to acknowledge our President's presence, President Firoz Rasul, our keynote speakers, Dr. Faisal and Dr. Maria. I think very informative sessions, and yes, there is enforcement fatigue. Communication is very important, and community engagement, as you said, and also vaccine hesitancy, which we all have to work towards, are important areas. We all are working towards it. It is also my pleasant duty to be thanking all who are behind. So I would like to, instead of taking names, would like to just share a few slides so you know that while 1,000 people are trying and getting and learning, our organizing committee so I'm just sharing my slide here. So our organizing committee chair, Dr. Asad Ali, our co-chairs, Dr. Afad Jan and Dr. Faisal, you all are learning from their capacities, which they have used to the fullest with the full team. So we have a team of 10 people in the subcommittee of the speakers for the workshops and for the scientific technical inputs. Our abstract committees, as Dean Adil mentioned, that we received overwhelming response. So about 9 members committee under Dr. Faiza Jahan, who have really worked hard. Workshop subcommittees, about 7 members were part of the workshop subcommittees. And at the end, last but not the least, 13-member committee administrative, which has all the support on online support for having this workshop and all the presentations for the next 2 days. So stay tuned. And the 3 major portfolios under which you will be looking at the presentation, you will be meeting the scientists and the professors. You will be hearing a lot more in the area of ethics, public health, vaccine. So do connect and keep learning. I would like to thank our finance, information technology, conference secretariat, communication, resource development. All have really made this journey possible, that they brought you technical information, as well as Dr. Adil mentioned, that last 22 symposiums have been around the global health issues, which have connected with Pakistan related issues. And of course, the obvious issue this year was COVID, and therefore challenges and way forward is the topic. And this will keep going on. Also, after the 2 days of conference, people will be working on the research and the learnings which we are having from 2020 and 2021. And Chief Minister, with your presence here, the work which healthcare forces have done at the front, I think we all have walked on thin ice. And as people say, that while we are walking on thin ice, might as well dance. And certainly the government have really worked hard with full commitment and passion, be it provincial government or federal government. And public-private partnership has been amazing. There has been a borderless information sharing and communication with everyone being together. And this is the learning and the beauty which I was sharing with my colleagues, that if we can put it in 5 E's, which we have worked through. So we have given the education, so people know the right information. We have started working on the engineering, so academic bubbles, smart lockdowns. A lot of engineering was done to stop the spread. We did the enforcement, which is very, very important, that you give incentives and you arrange some penalties also, so the people follow the enforcement and regulations. Engagement is very important from community, and then empowerment. So with this 5E model, where government has worked, public and private sector has worked, and this symposium is going to take us through the every E and how the research and the technical information can make us learn more and save lives. So stay stronger, stay safe. Allah Hafiz.